Give me a second. I know it's late in most countries, so this will be a public link. It will be there indefinitely. You guys can check it even later. So yeah, I sent it in the group. Let's begin this part. This is more of a webinar. So what I'm going to do is I'm going to summarize that what we already discussed during the clinical part. And I'm also going to add some information which is relevant to you in telling another person how to deal with osteoporosis. Also a disclaimer, this is not treatment principles. This is not going to be the same for everyone. You need to be assessed by a doctor or a physiotherapist if you are at a risk of osteoporosis. So we will quickly talk about these topics. I will send the PowerPoint after this is done. The first thing is the contents that we will talk about. We will talk about what happens to the body due to osteoporosis. Then we will talk about the risk factors, and then the 3 complications of osteoporosis and how to manage each of them. Finally, the diagnosis and how to treat them. Okay, let's go to the first one. So as we know, osteoporosis means formation of pores. This word means formation of pores. And you can see with age, as you grow older, the bone mass decreases. And you are left with all these holes, these pores. By the age of 70, you can see that it has affected multiple bones. And it has become severe enough that you are using a stick to walk and you are hunched over. Okay. So you can see the change of the bone with age. This is what happens to the bones. Now, how does the bone mass change with age? When you are young, the bone growth is greater than breakdown. But the moment you hit the age of 30 to 35, this has reached its peak. And then it is going to gradually decrease, while this gradually increases. So in a male, you will see the decline like this. You lose around 1% of the bone mass per year. And in a female, the loss is similar to a male, but the moment you hit menopause, there's a sudden drop. There's a sudden drop, and then afterwards it goes down similar to a male. And women have lower bone mass because they have less testosterone in their body. That means they have lower bone mass. Some of the most important risk factors for developing osteoporosis are as you grow older, and if you are a female, and then early onset of menopause is a risk factor. Then we have medications that you use daily to treat. If you are using aspirin daily, you are always prescribed omeprazole, so you have that risk factor. Then if you have rheumatoid arthritis, or if you have any kidney conditions, you will be prescribed these glucocorticoids. And if you have a history of fits, if you are using any medications to treat fits, then you are more at risk because there's going to be increased bone breakdown. Okay. Then there are some other diseases such as diabetes, parathyroid disorders, and kidney disorders which can increase your risk of developing osteoporosis. So some of the most commonly common drugs which can cause osteoporosis is prednisolone and omeprazole. Next, we'll talk a bit about this menopause. So when a woman reaches around the age of 51, they will have the final menses. And the way they know that is, obviously there's stopping of menstruation. There's another important thing that happens in some women, around 70% of the women, that is they have something called hot flashes. So they have this, this image represents everything. They have this feeling of heat in the face. It's very hot. They can have heart palpitations. They can feel like their heart is pumping hard. Then there's flushing of the face and the neck, sleep disturbances, perspirations, and cold chills. So these symptoms are treated with this drug called raloxifene, which is used for a short time, because there's the adverse effect in which it can lead to, over time, blood vessel blockage. So this is used for a short time, and this drug decreases onset of osteoporosis. It will delay the onset of osteoporosis. Next, we'll talk about the three main complications associated with osteoporosis. The first one is you are at a higher risk of fractures of the spine. The next is fractures of the hip, and finally, fractures of the wrist. These are related to falls. If the person falls down, you are at a high risk of these. So the first one is compression fractures of the spine. That is when your bone is weak, and if you bend forward in a bad way, in a way like this, you are at risk of compression fractures. Okay, and you might not know that you are having osteoporosis until a fracture occurs. So what happens is, over time, one bone is damaged, the second bone is damaged, a third bone is damaged. With time, the person becomes hunchbacked like this. This is what you call compression fractures of the spine, and usually this presents with back pain. You will go to the doctors with a lot of back pain. And also, over time, you may lose body height. You can see that this lady started at this height, but is now at this height. Next, this is the most important part. This is what a physiotherapist will teach you. Whenever, this is something that everyone needs to know, that is the proper lifting technique of things, of any objects. First of all, when you lift an object, you should never bend your spine like this. You should keep the spine straight. You can see here, the spine is straight. This is how you should practice lifting objects. And there also, try to keep the object as low as you can, below the level of the chest, basically. Okay. So this is something, this lifting technique is what is going to be part of the exercise regime. You need to always keep that in mind. You should never bend your back like this. You need to keep the back straight. Okay, this is the golden rule in physiotherapy of patients with osteoporosis. And if you have a fracture, there are different treatment options. That is surgical. So the first one is vertebroplasty. This is when, if there is a compression fracture here, what they do is they put a needle in and then they inject bone cement. It's basically what cement does. It's going to hold the bone in place, preventing further risk of fracture. Next, if there is significant height loss, if there is a lot of height loss, you can see that it's supposed to be at least this big, but now it has wedged, it has become compressed. So if that is the case, you do a surgery called kyphoplasty. In this case, you insert a needle and send in a balloon. And once the balloons are inflated, you get the height again. You can see it has the compression, what was compressed has come back to its original height. Then you insert the cement. And then you get a restored vertebrae. This is what you call kyphoplasty. And then there are back braces which can help posture and help when you lift. All of these, you can get a back brace which will help you, but this is usually reserved for someone who's around age 65 or who has a high risk of osteoporosis. The second thing is, as you grow older, the fall risk increases. So if you fall, there's a risk of you fracturing your hip. If you fall and you hit the side, if you fall down and hit the side, there's a risk of you fracturing your hip. And in osteoporosis, the hip is already weak. And if a hip fracture occurs, this is when you are at the greatest chance of death. 1 in 5 people die within a year, sorry. The main reason behind this is because they become bedridden. They can't walk anymore. It's a very challenging process to recover. And then they lose their independence. They can no longer do their own thing. They will need nursing care. And they might undergo depression. So if a hip fracture occurs, then that is going to increase your chance of being sick and losing your normal life to a high degree. This is something that happens with falls. There are certain surgeries that you can do, such as this internal fixation surgeries. You can put these nails to fix that into place. Or if there was a huge osteoporotic bone, you can remove that part and replace it with this metal device. Or if even the bone, the cavity is weak, or if it is damaged, you can do a total hip replacement, which will last for around 20 years. Next is the second risk factor associated with falling. The first one was the hip fracture. The next one is wrist fracture. So when a person falls, like with old age, the risk of falling increases. So when a person falls, they will put their hand out. Any person who falls, they will put their hand out, and there's a risk of this area being fractured. There are surgical treatments on. It is treated based on different patients' requirements. Some are not actually treated. Next is the diagnosis. So what you do is something called a DXA scan. This is an X-ray, and it costs in the USA it costs around $200, and in South Asian countries it's very cheap. It's actually similar to a normal X-ray. It's not an expensive test, and everyone over the age of 65 or 70, if you're a male, should get a DXA scan done. So there are some other risk factors which indicates you to do a DXA scan earlier, such as if due to some other reason you did a previous bone scan and it is showing low bone mass, or if you have a risk of fractures, if you have fractured before, or if you have a body mass index, if your weight is less, is low, is below the level that should be for your height, it's an indication for a DXA scan. And finally, if you are on glucocorticoid therapy, the prednisone, you have to do this. So this is how you do a DXA scan. First, you do it to one hip, the other hip, and then the spine. You need to do for all three. So you get 3 images, 1, 2, 3. And in this image, you can see the patient has got something called a T-score. Here's the T-score. Where's, okay. Here's the T-score. You look for this T-score, and you can see it is minus 1.6. So any range from minus 2.5 to minus 1, it is considered as osteopenia. That is, you are in the yellow zone. Your bone mass is low, and you have a risk of osteoporosis unless you make some changes in your life. If it is less than 2.5, if this value was minus 2.8, that means you are somewhere here, and you need to check that with your age. So the scan automatically gives you the results. If your age is 65 and it's in this zone, you know that you are at a high risk. If you are at an age of 65 and you are at this zone, you know your hip. In this case, it's the left hip, it's normal. And then you do it for the spine also. So in this case, if it's the same patient, the hip is also, the left hip is osteoporotic, and the spine is, okay, no, it's a different patient, sorry. This is an 80-year-old. You can see that the lumbar spine, so yeah, the spine is in the red zone. You can see the T-score here. They have given it for different levels. The T-score at this level is minus 2.7. What can you do at different ages? What are the exercises that you can do at different ages? So if you are before menopause, if you are young aged, your goal is to increase bone mass. There are certain exercises. If you are under the age of 65, and if you are osteoporotic or after menopause, then this is my own classification. This is not an international classification. I will use these words later on. Group B and Group C. I'm going to talk about some exercises. If you are part of Group C, you need to consult a physiotherapist first. Do not try these exercises until you consult a physiotherapist. So first thing, this can be done by everyone. Lifestyle changes. You need to make sure you get at least 1,200 milligrams of calcium and 600 international units of vitamin D daily. If you're a smoker, stop smoking. And if you drink alcohol, stop the alcohol intake. There are certain supplements that someone who's under the age of 35, even they can take this. And in Sri Lanka, this is around 1,800 rupees. So if you have risk factors for osteoporosis, let's say you have fits, then this tablet once daily might help. And it's as usual, it's best to ask it from a doctor and start taking this. Here is what this medication contains. There's 200 units of vitamin D, 600 milligrams of calcium, and then there are vitamin D tablets. These are supplements. This part is the most important part that I want to talk about. These are the exercises to not do with osteoporosis. If you have osteoporosis, you should never, like, it should not be part of your exercise. You should never bend forward like this, because that increases your risk of fractures. And then these exercises, they also increase the risk of a fracture because you compress, you are compressing. Like when you bend, you are putting a lot of force this way. So if this part of the bone is damaged, you are at a risk of damaging the bone. And then even the left and right rotations are contraindicated in people with osteoporosis. I'm talking about group B and C mostly. Group A, you are relatively free to do your own exercises, do weight exercises, build up your mass before you turn the age of 30 to 35. So these are the exercises you should not do. You should never do these exercises if you are in group B or C. Anything that turns, do not do these. Then the exercises to do, and the goal, the research-based findings is at least 30 minutes, 3 times a week is ideal. And there has not been proof that heavy exercise, there is no proof that says heavy exercise is greater than light exercise to build bone mass. There has been no proof of this. So one thing you can do is you can go on power walks. Go for your limit. You can't, if you should not start with 2 kilometers in the first day. You should start gradually. Start, let's say 15 minutes of power walk and gradually increase it to at least 30 minutes. Cycling, but this is best for group A mostly, and B, but then remember this has a risk of falling. Cycling has a risk of falling. Resistance training. We will talk about this in a while. So if you're in group A, do regular exercises, weight training, and lifestyle changes to reduce risk of osteoporosis later in life. But group B would benefit the most from these walks and these exercises that I'm going to talk about now. And group C should always consult a physiotherapist first. They should not try these without a physiotherapist's green light. Again, the golden rule is to keep the back straight. It should always be like this. So when we talk about the exercises, this is the one thing to keep in mind. Keep the back straight. And these two channels, they are physiotherapists. They treat people with osteoporosis and they show exercises that you can do. I actually took the exercises from them. First one is squatting. Keep the back straight. Keep the legs at around shoulder distance. And you squat. You come down. And the moment, like so, it's something like this. You come down. So do around 20 reps. This is the first exercise. And if you need help, you can use a chair like this person over here is using. Come up and down, keep the back straight. The next one is a leg raise. It's you have your back straight and you raise your leg. What you're doing is you are strengthening the muscles in this group. And when these muscles are strong, it decreases your risk of falling. So that's the second exercise. Again, start with 20 reps, increase as you go. The third exercise is swinging the leg. Again, back straight, your leg forward and backwards. Bring it front and back. So basically, and then side to side. Again, back straight, side to side. Both legs, again 20 reps at minimum. And finally, you can do this exercise. This is heel raise. Do not do jumping jacks. This can damage the spine. Don't do jumping exercises. But this is okay to do and is recommended. And finally, you can do strength training for the upper body also, because this will also increase bone mass in general. You can use a resistance band, and it shouldn't be like this. The arm should be locked here and bring it here. And there's one more exercise. You can, if your foot is here, you can bring your knee forward, back straight, and bend down. Bend down. So this point must coincide with the foot. This is also a good exercise, and don't try to keep the leg too far front, because when you have osteoporosis, it's very difficult to get back up. Finally, the treatment for osteoporosis, there are 4 main groups of drugs. Okay, sorry, 3 main groups. One is called the bisphosphonates. So these medicine, it should only be taken with plain water, and the person must stand or sit upright for at least 30 minutes afterwards. You should not sit down. You should not lie down, because this drug can damage your esophagus. This drug is not given to patients, or is rarely prescribed to patients with kidney diseases or esophageal diseases. If you have problems with swallowing, these drugs are not given. And this is how they prescribe it. Then there's 2 other types called denosumab and teriparatide. So yeah, that's the whole thing. These exercises, you can check them out here. Main